People are often interested in how you diagnose autism. Largely, I think, because it's not straightforward, because there isn't a test, there isn't a blood test or an X-ray that you can do and then know that you have a diagnosis of autism. It is a much kind of longer process than that. To make a diagnosis of autism, you do need to demonstrate that a person has deficits in the core areas of the condition, which is social interaction, communication, and stereotypical or restricted interests. And so the first thing I always do is I encourage people to do screening, because it is a long process. In terms of time and resources, it does take a lot of effort to go through it. So you want to be sure that it's something that is relevant to you. And screening can often be helpful in that. So if you present with symptoms that you think might be in keeping with autism, but actually when we do the screening, you're below the threshold, that's probably supportive that it's another thing and you should probably explore that. I think one of the important things to remember is, even when I've screened for possible autism spectrum disorder and the screening has come up positive, a not insignificant proportion of people come through that process and they don't have a diagnosis of autism. And sometimes that can be frustrating and even disappointing that you don't have an answer for why you have found things difficult. But actually, I think it can be helpful, because sometimes the symptoms and the struggles you've been having are because you have another disorder, for example, social anxiety disorder. And social anxiety disorder and generalized anxiety disorder in adults can look very much like autism, especially if it's severe. And, if it turns out that actually that was something you developed in your teenage years or as an adult, then clearly it's not autism, because you're a neurotypical, developmentally normal child. However, although you might not have the diagnosis, it does help, because then if you know that it's not autism and it is an anxiety disorder, then you can be really assertive in your therapeutic interventions for that. A lack of diagnosis can sometimes be disappointing for a person, but I do think it can be positive, because it helps you further along understanding the right support that you need. However, if the screening is positive, it's certainly worth exploring. And the way it works is we have to have a look at whether the person has had those deficits related to autism in childhood and adulthood. So one of the key features to remember is that people who have a diagnosis of autism have always had autism. They had it in childhood and they had it as an adult, but sometimes you don't realize it until later. But there's always evidence that there was something different in the way you thought or behaved as a child. So the process is very much finding out about that. So there's a very detailed history about development, especially in the early years. And we're also looking at, are there any behaviors that you have that might be different? And then also, it's important to make sure that some of the things you find difficult are related to a mental health problem or another neurodevelopmental disorder, for example, ADHD, so attention deficit hyperactivity disorder. And so they're the key features that we look at. And the way we do this is a long interview. So, very in-depth childhood history, what toys you like, when you learned to walk, when you learned to talk. And then also, a full psychiatric and mental state examination, and then screening for other neurodevelopmental disorders. So we do assessments where we look at how the person interacts with someone directly. So we also do direct observation, so looking at how the person socially interacts and communicates. And then you put all that information together, and then that usually gives us an answer. So it's not It's not the quickest of processes, but certainly you do learn a lot about yourself at the end.